Responsible parenthood involves making informed decisions about family planning, considering factors like financial stability, emotional readiness, and well-being of existing children. Reproductive children, on the other hand, exposes a broader concept addressing issues such as faith, sexual activity, access to healthcare, and the right to make choices about one's reproductive life. Together, responsible parenthood and reproductive health promote the well-being of individuals and families. This includes access to informed education and healthcare service. Related to the family planning and overall reproductive well-being, it emphasizes the important of making choice that with personal value, circumstances, and respecting the right and dignity of individuals.
Elements of reproductive health law. First is family planning information and services. Example na anino sa center no gina-recommend ba yun sa pamilya nga mag-family planning or mag-control. Example ano is kaning condom, pills, kaning IUD. Second is maternal, infant, and child health and nutrition including breastfeeding. Breastfeeding ug unsay makaayo sa sa infant or sa bata, mao man jud ang gina-recommend sa sa doktor sa immunized system sa baby para gina-recommend jud ang breastfeeding kay para good health ang bata. Number 3 is prevention of abortion and management of post-abortion complication. Ginabawal jud ang kaning abortion awareness muna siya. Fourth is adolescents and youth reproductive health guidance and counseling. Para sa mga youth or teenagers na dili mag PR o marital sex kay mga bata karon is mo na ang ilang usahay mo na ilang ginabuhat or kaning magkuan sila para ma-avoid ang teenage pregnancy. Magkuan sila mag sex education para sa educate ang mga teenagers. Fifth is prevention and management of reproductive tract infection or RTI or HIV/AIDS and STI. Example is para ma-prevent gani ang para dili ka matakdan HIV or mga sakit nga kung mag-6 man galing or example mag-6 mo, so dapat mag-control or kuan kang protection like condom. Kaya para kung mag-6 man galing mo, dili ka matakdan gani or dili ka 6 is elimination of obesity and other forms of sexual and GBV. Simple is anti-bawsi, violence against women and their children. 7 is education and counseling on sexuality and reproductive health. I-educate ang mga tao or mag-counseling sa reproductive health para i-awareness para makabalo pod sila ba. Number 8 is treatment of breast and reproductive tract cancer and other gynecology condition and disorders. 9 is male responsibility and involvement and men's RH. Yung mga responsibility sa mga lalaki. 10 is prevention, treatment, and management of infertility and sexual dysfunction. 11 is reproductive health education for the adolescents, and 12 is mental health aspect of reproductive health care.
So there are 7 salient provisions. First is the midwives for skilled birth attendance. The law mandates every city or municipality to employ an adequate number of midwives and other skilled attendants. So kailangan nga every city or municipality is dapat na ay mga midwives or skilled attendant kay para kung sa kaayuhan sila mga residente, particularly ka ng mga pregnant, no, kay ang role man yun sa midwife is katong provide sila essential care and support sa mga pregnant women, and also during sa ilang childbirth. So skilled birth attendance is nag-refer siya sa presence of a trained and competent healthcare professional such as mga midwife, because na sila knowledge of skills to manage normal deliveries and manage complications that may arise during childbirth. Second is emergency obstetric care. Each province and city shall ensure the establishment and operation of hospitals with adequate facilities and qualified personnel that provide emergency obstetric care. So, dapat yun i-ensure na each province or city is na ay mga establishment of operations of hospitals, and then na ay sa mga facilities or qualified ng mga employee na nag-provide of emergency obstetric care. And then ang emergency obstetric care is nag-refer to the provision of medical services with intentions to manage complications during pregnancy, child health, o postpartum period na nagbanta sa life or health sa baby o sa mother. So, it is critical component of maternal or newborn healthcare aimed at preventing maternal and neonatal deaths. Third is the hospital-based family planning. The law requires family planning services like ligation, mastectomy, and intrauterine device or IUD placement to be available in all government hospitals. So, kini nga law is nag-require siya sa tanan updated public health facilities, including hospitals, to provide a full range of modern family planning methods. So, these services include medical consultations, supplies, and necessary ng mga procedures of couples na gusto makaanak but experiencing infertility issues. The law aims to ensure na ang family planning services are accessible to all, particularly sa mga poor marginalized couples. Fourth is the contraceptives as essential medicines. So reproductive health products shall be considered essential medicines and supplies and shall form part of the National Drug Formulary. So, it can vary from country to country. So, in some places, ang mga contraceptives are consider nila nga essential ang medicines. So, they are recognized as important tools for family planning, preventing unintended pregnancies, and also promoting reproductive health. So, fifth is reproductive health education. Reproductive health education shall be taught by adequately trained teachers in an age-appropriate manner. So, this law highlights the importance of having trained teachers who can deliver reproductive health education effectively and in a manner that is appropriate para sa age of students. So, it aims to ensure na students receive accurate information, develop healthy attitudes or behaviors, and make informed decisions regarding reproductive health. Employers' responsibilities. Employers shall respect the reproductive health rights all their workers. Women shall not be discriminated against in the matter of hiring, regularization of employment status, or selection for retrenchment. Employers shall provide reproductive health services and education to workers. So, by enacting these provisions, the law aims to promote gender equality, protect the reproductive health rights of workers, and prevent discrimination against women in the workplace. So, it recognizes the importance of providing access to reproductive health care services and education as part of comprehensive employee benefits. The last one is the capability building of community-based volunteer workers. Community-based workers shall undergo additional and updated training on the delivery of reproductive healthcare services and shall receive not less than 10% increase in honoraria upon successful completion of training. So by including these provisions, ang law aims to ensure na ang community-based workers na involved siya in delivering reproductive health care services are adequately trained and up to date with the latest practices. So it recognizes the importance of ongoing training and professional development para ma-maintain ang quality of effectiveness sa reproductive health care services provided by these workers.
Prohibited acts. The law also provides for penalties for persons who perform certain prohibited acts such as the following: knowingly, with malicious intent, withholding or impeding the dissemination of information about the programs and services provided for in this act, or intentional giving out incorrect information. So, it means that sadyang na may malisyosong layunin, pagpili o paghadlang sa pagpapakalat ng impormasyon tungkol sa mga programa at serbisyong ibinigay para sa batas na ito o sadyang nagbibigay ng maling impormasyon. Refusing to perform voluntary ligation and vasectomy and other legal and medically safe reproductive health care services on any persons of legal age on the ground of lack of spousal consent of authorization. So, it means refusing to perform voluntary ligation, pagdumili sa pagbuhat o voluntaryong ligation o vasectomy, no? O uban pang legal o medical nga luwas nga reproductive health care nga mga serbisyo sa bisan kinsang tawo sa legal nga edad tungod sa kakulang sa pag-uyon o pagtugot sa asawa. Refusing to provide reproductive health care services to an abused minor and or an abused pregnant minor whose condition is certified to by an authorized BSWD official or personnel, even without parental consent, particularly when the parent concerned is the perpetrator. So, it means pagdumili sa paghatag o serbisyo sa pag-atiman sa panglawas sa reproduktibo sa usa ka menor di edad nga giabusuhan o usa ka menor di edad nga giabusuhan nga mabdos kansang kondisyon gimapatud-an sa usa ka otorisado nga opisyal, no, o kawani sa DSWD bisan kung walay pagtugot sa ginikanan, labi na kung ang hingtungdan nga ginikanan mao ang naghimo niini. Refusing to extend reproductive health care services and information on account of the patient's civil status, gender or sexual orientation, age, religion, personal circumstances, and nature of work,
provided that all conscientious objections of healthcare services providers based on religious grounds shall be respected, provided further that the conscientious objector shall immediately refer the person seeking such care and services to another healthcare services provider within the same facility or one who is conveniently accessible, provided finally that the patient is not in an emergency or serious case, as defined in Republic Act 8344, penalizing the refusal of hospitals and medical clinics to administer appropriate initial medical treatment and support in emergency and serious cases. So, it means that pag dumili sa paghatag o serbisyo sa pag-atiman sa panglawas sa reproduktibo o impormasyon tungod sa kahimtang sa sibil sa pasyente, gender or orientasyong sexual, edad, relihiyon, personal nga sirkumstansya, no? O kinaiya sa trabaho, kung ang tanan nga pagsupak sa konsensya sa mga tighatag sa serbisyo sa pag-atiman sa kahimsog base sa relihiyosong mga sukaranan, kinahanglan usab ini nato nga respetado, no, sa kondisyon dugang pa nga mga masupak tungod sa konsensya. Tungod niini kinahanglan dayon nato nga i-refer ang tawo nga nangita sa ingon nga pag-atiman ug pag-serbisyo sa lain nga tighatag. Sa serbisyo sa pag-atiman sa kahimsog sa sulod sa sa parehas nga pasilidad o usa nga dali nga ma-access, no, sa katapusan nga ang pasyente wala sa usa ka emerhensya o seryoso nga kaso sumala sa gipasabot sa RA 8344 pagsilot sa pagdumili sa mga ospital o medical nga klinika sa paghatag og tukmang inisyal nga medical nga pagtambal og support sa emerhensya og seryoso nga mga kaso. Requiring a female applicant or employee as a condition for employment or continued employment to involuntarily undergo sterilization, tubal ligation, or any other form of contraceptive method. So, when you say requiring a female applicant or employee as a condition for employment or continued employment to involuntarily undergo sterilization, tubal ligation, or any other form of contraceptive method. So, it means that nag-required usa ka babaye nga aplikante o empleyado isip kondisyon sa pagpanarbaho o padayon nga pagpanarbaho nga dili voluntaryong mupailawan or mupailawom sa sterilization, tubal ligation o bisan unsang matang sa pamaagi sa kontraseptibo.
Legislating RH. It means an element often used the crituques converters involved regulations to manage an instruction use the disposal to minimize environment impact that ensure responsible sourcing. It may also include measures to curb illegal greed of the high market. So for governments and legislations to monitor, control, and emissions from the industries using rhodium, imine, and mitigate air the water pollution. Additionally, regulation that might add risk to the promote sustain to reduce demand of new rhythm injection. So let us proceed. The root of enactment of RH law was the painstaking path. The main blocking was the constitutional provision, particularly that provided in Article 2, Section 12 of the 1987 Constitution, which mandates that. So the state recognizes the sanctity of life, shall equally protect the life of the mother and the life on unborn and conception. So sanctity of life, it does bodily woman life in an intrinsic good, and that it's what always impermissible to kill an innocent woman. Kanang like for example kanang mga mama nang gabuntis, yun nga ang ilang mga anak is ipalaglag, like for that, I mean rather. It was regarded in 1987 Constitution itself a mandate of the Philippine government that recognized the importance of life and protect of life of the mother and unborn. So in as much of our artificial family planning methods and IUDs, condoms, and are labeled an anti-life and against conception. These are interpreted to be against the sanctity of life, the contrary of the said fundamental law of the land. In addition, this pro-life strongly advocate and use the natural methods, absence and calendar methods. So it is kanang artificial family, kanang kalit-kalit na ganyan kami yun, like kay let's kanang naabot siya sila mga control like IUD, condoms, kanang mga mama na to na magana sila mga protection, like for example uncertainty of life making contrary of the said the pollution, like for that. So let us proceed. On the another land, advocates and Arlo counter this concept pro-life treating abortion patient product of scientific findings which they claim otherwise. What this debates and missing out the currently the spirit of the law to allow woman to choose the fairly whatever methods of family planning. It was an appropriate of them claiming and that one is better than compared than another delimit this as a possibly free choice woman through deserve kanang mga tao ay kanang mga bae nga kay kanang magpili jud sila kung sa mga deserve nila, like kanang magplan through planning family. That's all.
The Philippine government has been discussing a unified reproductive health policy since 1960. The RGM law was enchanted in 2012, but it was challenged and delayed in 2015. A TRO was issued to prevent the FDA from distributing or issue new certification or product registration. With the hefting of the TRO, the Department of Health have freely distribute contraceptive.
So, reproductive health lang ay ipagtibay or ipapuskan or niagi sa challenges o pag-delay tuig 2015 ang kay nag-issue nga PDE, or foods, drugs, and administration to distribute. So maututungod sa tabang sa POR, ang DOH, Department of Health, kay free na sila mo distribute og mga contraceptive. So for example, aning contraceptive nila ka ng pills, implant, undo.
Enactment of the Reproductive Health Law. Law was by the constitutional provision in Article 2, Section 12 of 1987. Constitution, the law mandatory that the state must recognize the importance of life and protect the life of the mother and unborn. Artificial family planning methods are labeled as anti-life against conception, while natural methods are advocated for. The debates are missing the spirit of the law, which allows women to choose freely whatever methods of family planning is fit and appropriate of them. Long political battle no, gihadlangan sa constitutional provision in Article Section 2, pero kana nga sugo sa law gimando sa pagpaila sa kung unsa ka importante sa kinabuhi ang pagprotekta sa usa ka inahan or unborn kanang wala pagi ana kanang naa pa sa tiyan sa inahan kana. Ang ginatawag ano kay artificial family planning methods kay level na siya as anti-life, pero anti-life or kontra o against sa paglihi. Well, sa natural methods no kay freely siya kung unsay gusto sa mga magtiayon nga fit para ilaha gamiton. Kay kung mas religious ni kung maggamit og methods tawag dayon ano is punit, pero naay naano ni sa kababaihan, while sa natural giwala nila ang spirit law kay mas giuna nila ang freely to choose ang methods na fit is to use.